Welcome to Marina Salud, the private company that manages public health resources in the Marina Alta region of the province of Alicante. This region is one of the Spanish Mediterranean's main tourist and residential areas. Almost half of its approximately 200,000 inhabitants are foreign nationals from European countries. Marina Alta represents quality of life. It has a good climate, the Mediterranean diet, and built-up areas which, despite having grown in recent decades, are not overcrowded. The region means for Europe what Florida means for the United States. This is also true in demographic terms, because the population is aging and the natural growth rate is negative. Marina Salud is a joint stock company. The German DKV medical insurance company has a 65% shareholding, and Ribera Salud, the Valencian company which pioneered implementation of the public-private partnership model in the Spanish healthcare system, holds a 35% stake.
El modelo valenciano, que es como se conoce, consiste básicamente...
The Valencian model, as it is known, basically involves separating the financing of public health services from the provision of those services. Financing remains the responsibility of the state, and the services in this case are provided by our company, which is quite distinct from the regional government itself. We have to comply with healthcare policy laid down by the Ministry of Health. Patients are guaranteed the same care they would receive from a public provider. The financing of Marina Salud as a private provider of public services is 95% dependent on the state and on the capitation base, which means that an amount is assigned according to the number of people treated in our hospital under the right to receive public health care.
However, regardless of the model, the success or failure of a health system is measured in patient satisfaction. In the latest survey, users gave the company a score of 8.48 out of 10 for the quality of service received. Moreover, the satisfaction curve shows a strong upward trend compared with complaints.
The home hospitalization unit is a hospital department. Because patients are treated in their own homes, most of them assume that they have not been hospitalized, but that is not the case. They are for all purposes hospital patients and have the same rights and conditions as patients admitted to the hospital itself. The advantage is that these patients remain in their normal environment and their quality of life is much higher.
One of the targets the company set itself was to provide its customers with a full range of services, with procedures and skills worthy of a benchmark hospital. The goal was for patients in the area not to have to travel to the nearest major cities, which are around 100 kilometers away. So as well as basic services, the hospital in Denia offers radiological intervention, obesity surgery, plastic and reconstructive surgery, thoracic surgery and maxillofacial surgery, among other services. It is gratifying to know that we work in the largest organization in the entire Marina Alta region. What is more, we apply a consistent approach to healthcare, so the decisions taken for the benefit of patients are always integrated and make sense. I also think it is very important for the patients to know that their doctors are in close contact with the specialists and that they can make joint decisions to achieve the best possible care. Another of the commitments made by Marina Salud was to ensure that all local residents enjoy the same level of access and service, so that in an area of over 750 square kilometers, the company offers patients 1 acute care hospital, 4 integrated health centers, 8 health centers, and 34 auxiliary branch clinics.
In the same way that we nurses make our discharge reports, the doctors also make theirs, and they are delivered to the responsible physician. If we know what is happening to patients, we can help them wherever they are, at the health center, at home, or here in the hospital. The most important thing is to know what is happening to patients and how we can help them.
Continuity of information and clinical processes is possible here thanks to the full electronic medical record provided by the Millennium system from the American company Cerner. These records ensure not only that no information is lost, but also that it is constantly updated, resulting in a more secure system for patients.
La ventaja fundamental de un sistema de información.
The essential advantage of a unified information system is that it enables us to find out the patient's current situation, what we have done in the past, and also what we are going to do through the protocols at any time and at any primary care facility. The Marina Salud hospital in Denia was the first in Spain and the second in Europe to obtain HIM-SS Level 7 out of 7, a rating awarded by the Healthcare Information and Management Systems Society. The company achieved this level thanks to the high degree of integration provided by its electronic medical record system. Half the hospitals in the United States are currently rated at Level 3 and only 0.7% at Level 7. The security that the information gives to patients lies not only in the quality of their clinical records, but also in the voices and hands of the professionals who look after them. Marina Salud has set up several schools for patients to resolve their doubts before undergoing surgery and to prevent health problems. We get a group of people together and give them an informative talk explaining the most important things they need to know. From then on, the patients gradually begin to find out about the details of the intervention, hospitalization, and also rehabilitation later on. The rate of customer satisfaction is very high because people feel very supported right from the start, and that helps them to make a better recovery. Information, prevention and health promotion are therefore key factors to achieve a healthy society and thereby make Marina Alta a geographical enclave where not only the quality of life but also life expectancy are among the best in the world. And we are committed to working to make sure this remains so. Over the next 10 years at least, life in the Marina Alta region and the Marina Salud Hospital will progress hand in hand under the long-term contract signed between the regional government and Marina Salud. Together, we will lay the foundations of a health plan for the present generation and those to come.